Subscribe to our YouTube channel and don't forget to press the bell icon to get our latest updates.
See, as the treatment for dementia can be considered, the medical treatment for dementia can be considered two broad headings. In fact, I would say three broad headings. The first one are primarily for improving the cognition.
Right.
We call it cognitive enhancers. There are different drugs which are available, drugs like donepezil, rivastigmine, galantamine, and also memantine. So these are the different drugs which can be used for improving one's memory and cognitive function. Now, these drugs are helpful in early stages of dementia and also in the moderate to severe stages of dementia to an extent. But they do run out of juice after some time because they act on existing neurochemicals in the brain, and as dementia advances, there is very little that can be done in terms of improving those activities. So that class of drugs are useful in the early stages of dementia, early to moderate stages of dementia. So definitely, that's one of the reasons why I say it's important to get your diagnosis early, and these medicines can definitely make a difference at that stage. Okay. The second class of drugs which are useful in people with dementia are those that help control the behavioral symptoms, the problems like agitation, restlessness, aggression, sleeplessness, and those kind of things. Now, it's important to understand why these symptoms occur in someone with dementia. The common precipitants for these symptoms are usually a physical cause. So either it could be an unexplained pain, undiscovered pain. I mean, obviously, when someone develops dementia, their ability to communicate decreases. They will not be able to tell us they have a headache, they have a backache, or they have a toothache. Now, what we will observe is that they stop eating, or they become less kind of interactive, and they become less engaged in activities, or you may find that they are not sleeping very well. So these may indicate the person might be in pain. And if you touch them and move them, you may get a fierce resistance, and you will not be even get close to them to lift them up. So those kind of things will indicate that they may be in pain. Other common things like dehydration, very common in people with dementia, constipation, common urinary infections or chest infections. These are some of the common physical problems which directly results in behavior. I mean, just to give you an example, the last time you had a cold, last time you had a minor infection, how did you feel? You felt miserable, you felt bad.
Right.
Okay? But you were able to go seek medical help, take medicines, and feel better. But unfortunately, for someone with dementia, it's very difficult. They need help to kind of feel better and get better. So they need someone to do these things for them. And sometimes it's missed. So that can result in behavioral changes.
Right.
Then, of course, the third important reason why behavior happens is they're not engaged. They're just bored. And then someone is bored and not engaged meaningfully in doing something. We saw this during the COVID. When you're locked down in the house, you're not able to go out and do things that you're doing. You're bored. You're kind of numb out of your mind. So that can cause some behaviors. They just want to get out. They seek some stimulation for their brain.
Right.
So these could be, if you have any of these problems, then it's important that you address them.
Right.
Now, if you can't address them or if the behavior is so bad, then yes, we can actually give them medicine. Now, these medicines again have a very limited role to play, but can potentially decrease some of the problems.
Right.
The third class of drugs are general drugs which the person needs. So just to control their diabetes, to control their hypertension, heart disease, and things like that. So these medicines, if they are missed, they cause problems because say someone has diabetes, they're not taking the medicines frequently. Obviously, they have to use the bathroom more frequently. They have to get up and go urinate more often. That results in disturbed sleep, and they may generally feel a bit unwell, results in behavioral problems. So the medicines can help with those kind of problems also. So these are the different types of treatments that are medical treatments that are available. So when you deal with someone with dementia, whether you decide which medicine is more useful at what stage, you have to consider all these things into perspective, take all these things into perspective and provide advice. So we can actually look at this person in the clinic and see how best we can help at this point in time.
Right. Thanks. And just on that, you are doing telemedicine as well, right? So people can reach out to you on, okay.